I'm going to be presenting this next section on hepatitis B, prevention, treatment and pathways. My name's Neylan Aykut. I haven't actually introduced myself properly yet, other than through the emails in the lead up to this, but I'm part of the health promotion team. And there's been two main focuses for me with my health promotion outreach in this role at LiverWELL. The main one has been working in custodial settings. So just letting you know that we've had active programs in 10 different prisons across Victoria. So if anyone has any questions related to clients who've interacted with the justice system, that's something that we're pretty uniquely placed to be able to comment on, because we've spent time educating around the programs both inside and outside the prisons. So feel free to get in touch. While that's fresh in my mind, it's not specifically hepatitis B related, but a lot of people say that they have clients coming out of prisons who don't have their medical discharge forms. There is actually a way to be linked to that information with the medical systems around hepatitis B and hepatitis C within the prisons. So if people would like to get the email of how to get linked with that information, please put it in the chat and we'll make sure to include that. So hepatitis B, prevention, treatment and pathways. I always find hepatitis B a little confusing, but I'll do my best to try and make this clear. But and feel free to jump in with questions at any point. So hepatitis B is a very, very old virus. About a third of the population has been infected at one point in their lives. So it's very prolific as well out there. In fact, I remember being fascinated by a presentation in the past that was showing how the history of human movement has been able to be tracked through looking at different types of hepatitis B and where they have been traced. It's very interesting. In Australia, it's estimated that more than 1/4 of people living with chronic hepatitis B have not been diagnosed and unaware of their infection. So that's very concerning, and we really do want to increase the amount of screening happening for hepatitis B in the community. On top of that, and Jen McLaughlin did touch upon some of these points in her epidemiological overview, but we have not enough people who are diagnosed with hepatitis B accessing care, and even less accessing treatment. So more than 70% of people living with chronic hepatitis B are not receiving care. And by care, we mean having checkups and making sure that they're actually booking in for the next checkup and putting that in their diary, and are aware that they need to be monitoring their hepatitis B. So when people get diagnosed, often people walk away and they don't do anything else about it, which is not a situation we want to see occurring. 10% of people living with chronic hepatitis B are getting antiviral treatment. This is half the number estimated to need treatment. So there's also a real lack of people progressing onto the pathway of accessing treatment. So that gives you an idea of some of the things we would like to see change around hepatitis B. But hepatitis B is confusing. For most people, viral hepatitis is asymptomatic and hepatitis B is no different. Some people might experience fatigue, loss of appetite, jaundice, and joint pain. So jaundice is when people look a little bit yellow. And to be honest, if somebody has jaundice, they have probably got quite sick. So we really want people to be getting screened before they have any concerns about any symptoms. And I guess it's the same message as we had for hepatitis C, that really the only way to know if you have hepatitis B is to have a test. It's a disease that lingers in the body for many years, even decades, before serious health implications. And one of my pet hates with hepatitis B is that we have this unfortunate language that is quite common still. It is being phased out, but it's still often people are talking to me. I'm hearing anecdotally that they've been told that they're a healthy carrier, which is confusing and also misleading, and I think is one of the reasons why some people don't access ongoing care, because they're told they're a healthy carrier and they don't realise that that means they still need to monitor the progression of that hepatitis B. So I'm really hoping that we can get rid of that expression from the clinical community, and when people find out they have hepatitis B, the expression healthy carrier is not part of that discussion. So just backing up a little bit to transmission, hepatitis B transmission can occur in all of the same ways as hepatitis C. So through the blood of a person with hepatitis B entering into the bloodstream of another person, but also it can be passed through sexual fluids as well, through unprotected sex, for example, and it's much more commonly passed from mother to baby. So if a mother has hepatitis C during birth, it may be around 5% transmission likelihood, whereas from mother to baby, for a woman with hepatitis B, it's over 90%. It's really likely that it would be passed. So other transmission routes for hepatitis B and C as well is sharing injecting equipment, unsterile tattooing and piercing, sharing snorting equipment. That one often surprises people, that snorting equipment is a transferal method, but it is because through our mucal membranes in our nostrils. Blood products and transfusions, for example, and as flagged by Isabel, that's really before 1992 in Australia, but can be very recent in other countries. And as Jen McLaughlin mentioned, around 90% of people with chronic hepatitis B in Australia are born in other overseas. Mother to baby, very common way for hepatitis B transmission to occur. Sharing grooming items and also workplace exposure. Sharing grooming items is something that people with hepatitis B are encouraged to practice. Chronic hepatitis B are encouraged to practice keeping their personal items in a case or like a sponge bag that they can put it up high, because sometimes kids can kind of get into your bathroom and get into all of your things. If we get blanket vaccination, that's really not an issue, but it's still something that we encourage just to be on the safe side. So hepatitis B can be acute or chronic. The acute phase can last for up to 6 months, during which time you can transmit it to others, whereas chronic hepatitis B is for life. There are organisations working on a cure for hepatitis B, and there have been significant breakthroughs, but we haven't got to a cure phase at this point. But hopefully that will be something that we'll see in our lifetime. That would be amazing. If you're exposed to hepatitis B when you're a baby, you're 95% likely to progress, for that hepatitis B to progress into chronic hepatitis B. If you're exposed to hepatitis B as an adult with a healthy immune system, then you're 90% likely to clear the virus and not progress from the acute stage to the chronic stage. Did anyone have any questions about any of that so far? I'm just flicking through. I'm sorry, I can't actually see the chat. So Pearl's going to let me know if you put questions into the chat that I can't see. So just so you know. How long until you know after exposure? So the average incubation period is 90 days. So usually we would say to someone to wait 3 months if they think that they've had an incident where they've been exposed. But as you can see on this graph, I actually think that 24 weeks is a bit long. I've heard up to 21 weeks, but 24 weeks might be a little bit of an old bit of data there. But it can be in the incubation stage for a really long time. I really like this as a layout to have something to refer to and get a quick overview of hepatitis A, B, and C, this graphic. But yeah, so people do have to wait for quite a while. I guess the only exception to that is if you are sure you've been exposed to hepatitis B, that you can actually go and get the immunoglobulin so that you don't progress into have contracted hepatitis B. Hopefully you can see this graphic well. Hepatitis B testing is very confusing for a lot of people. There's 3 different tests that need to, or 3 different assessments happening in the pathology that need to be part of the assessment from the blood test for hepatitis B. But it is really great because you can learn so much from that assessment. But unfortunately, we do hear anecdotally that people still sometimes only do 2 of the 3 tests, or are missing parts of the data, and then people have to get tested all over again, or they end up with a confusing analysis of their status. But it's great. A lot of people can't remember if they've been vaccinated. So it's a really good test to be able to find out if you've been vaccinated before, if you've been exposed to hepatitis B and you've managed to clear it and you're now immune, if you have active hepatitis B and you need to go into a care plan, or if you have never been exposed and you are not vaccinated and you should be offered a vaccine.
Neylan, sorry, we have a question in the chat from Wendy.
Yeah.
She's asking, with mother to baby transmission, why do the offspring not clear the virus?
Because their immune system is not fully evolved, they're just not generally able to clear it. Yeah, it's just much more likely to. So that's not a very clinical explanation. But I'm afraid my background's not clinical, so that's probably the best you can get out of me. But it is why there's one of the reasons why there's been such a focus on vaccinating newborn babies, and it's one of the reasons why hepatitis B screening is something that all pregnant women are offered. And because if somebody has hepatitis B, a pregnant woman has hepatitis B, then you need to start planning to assess her viral load and think about how to reduce her viral load before that childbirth is occurring. Did that answer the question? Sorry if you can hear my dog being a weirdo in the background.
Yeah, thank you. That was good.
Okay, great. Thanks, Wendy.
Yeah.
So hepatitis B testing results are very confusing for a lot of people. However, so this is a good graphic because it encourages, even when it looks like you can see that there is an infection, there is a next step of getting somebody who has perhaps a little bit more experience with hepatitis B, if you don't have a lot, to get involved in that process. And as mentioned by Isabel earlier, you can do a search on the ASHM website to find people who've had more experience with hepatitis B. I also know that Vital do offer online training programs to get people to be able to become hepatitis B prescribers. So that might be something that you'd want more information about, and feel free to ask us to link you with that next offering. So who is at risk for hepatitis B? Migrant and refugee communities. Again, as mentioned, around over 90% of people living with hepatitis B in Australia are born overseas. Aboriginal and Torres Strait Islanders, that's really more the case in other parts of Australia. we have really good screening and assessment systems in Victoria around hepatitis B for Aboriginal and Torres Strait Islander people. That's not to say we should reduce that excellent program, but just to point that out. Men who have sex with men, people who inject drugs, sexual contacts and family of people living with hepatitis B, which probably should be at the top of that list. Sex workers, although in my experience, sex workers are some of the most well-informed people around transmitted viruses. Hemodialysis patients and people living with hepatitis C or HIV. So, and if you've never seen this map over to the side here, that just gives you an idea of countries where there is high endemic rates of hepatitis B. It's very interesting. In Southeast Asia and the Pacific has very high rates, and also sub-Saharan Africa. Vaccination for hepatitis B. So we have a really great vaccine. As mentioned earlier, the vaccine was created by Dr. Bloomberg, whose birthday it would be today, and while we celebrate World Hepatitis Day on the 28th of July. And adults should be tested to see what their status is before vaccination is offered. Vaccination has been offered to all newborns in Australia since the year 2000. We did have it offered before then, but it wasn't across the board. Now it is across the board in Australia. So 4 doses are required for immunity at 0 to 4 and 6 months. And birth dose of vaccine should be delivered within hours for children of mothers with hepatitis B. So it's something that hopefully there'll be a management plan in place early on. We have actually been involved in some research around this recently that's shown that some hospitals don't always have the hepatitis B vaccine on hand, which can really slow down that process. So that's something that we hope there'll be some more advocacy about closing that gap with. Vaccination for adults is 3 doses over 6 months. So that's at 0, 1 and 6 months generally. And a month after the completion of vaccination, a person should usually get tested. Sorry, little typo there. Did anyone have any questions about that? All right, we'll keep going then. So the eligibility for free vaccination. This can be quite confusing for people, but it does really make a difference to a lot of people to be able to access free vaccination. So all refugees and humanitarian entrants are able to be offered vaccination for free, which is fantastic. Despite not having Medicare card, that is something that can be offered. Household contacts and sexual partners of people living with hepatitis B can be given the vaccine for free. People who inject drugs or on opioid substitution therapy, people living with hepatitis C, men who have sex with men, people living with HIV, people no longer in a custodial setting who commenced but didn't complete a free vaccine course whilst in custody, and people born in priority hepatitis B endemic countries arrived in Australia in the last 10 years. That one's probably the hardest to interpret. The countries, the 10-year period. I really encourage, if you can actually give it to people for free, then that would be something to try and work with. It is open to interpretation a bit. So yeah, I would hope that most people would be offered that if they're considered at risk, and it is definitely something that you can apply a little bit of interpretation. So here's an example of a very confusing graph, and that is commonly referred to around decision making with hepatitis B. I have a presentation that will be played after mine from Dr. David Iser that's going to talk a little bit about the way that these are interpreted and treatment pathways that will hopefully give a bit more clarity on this. There's a lot of people who believe that this process is much more confusing than it should be. I still, in terms of talking to community, I still tend to explain hepatitis B in quite an out-of-date method, actually, which is to talk about the sleeping bear, the hibernating bear. So that's how it was taught to me, and I still haven't actually found a better way to explain it to people that, you know, once you have hepatitis B, it travels into your liver, and sometimes it just goes to sleep there and it's resting in your liver and it's not being too active. You still need to be careful, but that's why going into care and making sure that you're monitored is really important, because you're actually checking to see if that bear has woken up. And if the bear wakes up, then that's when the virus starts reproducing itself, and that's the point when a lot of people are recommended to go on to treatment. But as you'll hear from Dr. Isa, there's a few different recommendations around that now. So liver health should be assessed every 6 months for people with chronic hepatitis B. They should be going in for screening and assessment. The current treatments are tenofovir and entecavir for children aged 2 to 11. It's usually lifelong once started, and there really is, like, you're very much encouraged to continue, be very consistent with your medication. So that's one of the reasons in the past why people have not been put onto it straight away, because there's been concerns that if people miss their medication, then they might build up resistance to that medication. It does seem like it's a little bit less of an issue than we once thought, that people are able to miss a few days and get back onto it without it being the end of the world. Absolutely want to encourage people to maintain consistency if they can. And in the tools and resources section, we'll be talking about some methods people can use to help manage that. But the aim of the treatment is to reduce damage to the liver and reduce the risk of liver failure and liver cancer. So I think, I'm not sure if this was shared in a different presentation, but in terms of monitoring for that most common form of liver cancer in Australia, people with cirrhosis are encouraged, you need to monitor them. And for people with chronic hepatitis B, even without cirrhosis, it's Asian men older than 40 years, Asian women over 50 years, people born in sub-Saharan Africa older than 20 years, which is very young. So that one often surprises people. Indigenous and Torres Strait Islander people older than 50 years. So there is a bit of a genetic variability. Also with the sub-Saharan African strain, that's to do with other elements of living in sub-Saharan Africa that come into play as well as genetic aspects. Now, most of you will know this, but some of you may not, that a person with viral hepatitis does not have to disclose their status. This includes to employers, doctors, dentists, social workers, partners, Centrelink government officials, etc. So I think possibly the only exception to our list is that they do actually really encourage in prisons that people disclose. That's something that they've kind of taken their own track with a little bit in there. The other exceptions are if you're joining the Australian Defence Force, taking out insurance like life insurance or income protection, donating blood, you're a healthcare worker doing exposure-prone procedures, or, I mean, this last one I didn't think was very common, but now after interacting with a lot of people in the prisons, I've realised it's much more common than I expected. So if you participate in sports without the blood rules, so cage fighting and mixed martial arts. 2 examples of that. So some people decide to disclose because they're concerned about transmission to others, also because they want support and understanding. Maybe they're starting an intimate relationship. It's relevant to pregnancy and childbirth, and to better facilitate their healthcare. But some people don't want to disclose, and that's really is their right. It's important to remember that. And that's because of there's sometimes associations with injecting drug use, particularly around hepatitis C. I've heard a lot of people say with hepatitis B that they think people will assume that they've been sleeping around. There's some uncertainty and fear, and there can be a lot of stigma and discrimination out there, which continues to be something that's a very important aspect of the work that we do, is working around stigma and discrimination. So navigating life with hepatitis B. Some people were having their visas rejected on the grounds of their expected medical costs. So people with hepatitis B also were having issues with visas in Australia. So Hepatitis Victoria was really involved in the advocacy from this sector around this, and it shouldn't be happening anymore, but it's still distressing, and we've got a resource. If you know anyone who's in that situation, you can refer them to us, and we can offer them some support with that. Some people are asked to show proof of vaccination for hepatitis B for their work, and it's quite a difficult grey area, because if you have chronic hepatitis B, you can't show you've been vaccinated, but you don't have to disclose that you have chronic hepatitis B. So it's a little bit of a catch-22, and that's something that we've had more and more calls about over the years. And we're trying to work with various training organisations and employers. And again, I would recommend if you have that situation with any of your clients, that you encourage us them to contact us, and we can help them with advocacy and trying to navigate that pathway, because it is quite difficult. Oh, this is the slide that I meant to finish. And we're fast coming to the end of my presentation, so we're quite early on this one. But the other point that I wanted to say with navigating life with hepatitis B, well, there's a few points, but we've got a range of resources around healthy liver lifestyles that we'll be going through at the end of today, that are really relevant if you have chronic hepatitis B. And so they're kind of tools and resources you can offer your clients. And you really shouldn't drink alcohol if you have chronic hepatitis B. That will make a huge difference. So we really recommend people get referred to AOD services to get support with that if they are drinkers. There's also a new-ish, set up last year, organisation that was set up by a doctor and researcher, Dr. Thomas Tu, who also has hepatitis B, and set up this online community, and it's fantastic. I've joined it, and the in-depth streams and conversations and support that occur on that are really amazing. So I highly recommend you link people in with that as a good place to take their concerns and have discussions and get into the real nitty-gritty about various elements of living with hepatitis B. Did anyone have any questions? I've got through that much quicker than I had intended.
Oh, hi, Neylan. Jane calling. Jane here today from Gippsland Lakes. I just wanted to ask you, please, I probably missed a few things, but could you clarify for me the possible best way to prevent hepatitis B, I suppose, active infection in a newborn? The best way to sort of deal with that for a pregnant mother?
Is this when the mother has hepatitis B? Yep. Yeah, so what we've found from recent research is often people are finding out about their hepatitis B status for the first time when they're getting screened for a pregnancy. So it's actually an important aspect of this that seems to be getting missed, is that people are going straight into management processes around the pregnancy and the health of the child, which is really important, but sometimes the conversation explaining what hepatitis B is and assessing that whether that mother is aware of what they're going to need to do to get into their own care is being missed. So that's something I'd really like to flag about that, because that's quite concerning. It's very understandable. There's a lot of competing aspects when you're managing a pregnancy, but it is something that we're really hoping to change. And it also makes the process with the baby easier, because the mother will have a better understanding of why that process is occurring and why all of the different steps are necessary. But generally, a woman's viral load will need to be assessed, and she will need to be put on to medication to reduce her viral load. And when the baby is birthed, it's encouraged that they receive their first vaccination within hours, and then follow the 4 vaccinations, and also make sure that there is that follow-up check after the vaccinations are complete.
Thank you. I was just wondering, does that mean that there's a high possibility that the baby, I know I'm focusing on the baby again, but does that mean that possibly the baby may avoid having chronic hepatitis B or not?
Oh yeah, it's when all of those steps are taken, it's really it's not 100%, but it's very high percentage that you'll be able to avoid passing on to the baby, and that's a really important thing to be able to explain to the mother as well. The other thing that's often being missed as well is encouraging that mother to suggest that the rest of the family are screened as well, especially because so many hepatitis B stories are family stories, and unfortunately it's not something a lot of families talk about. They might know that Uncle James passed away from liver cancer, but they might not know why. It just may not be a conversation that's ever come up. So it is a really unique opportunity to possibly get a whole family into care and their contacts. Does anyone else have any questions? I should flag, actually, it is something that we're going to be looking into a little bit more later in the year, about doing some more outreach around maternal childcare clinical staff and how they link people with those services and what resources they need to support that. So if any of you in any of your settings, we will have the session at the end of the day going through the resources and tools that we can offer. But if there's anything that you feel like you could benefit from, or your clients could benefit from, let us know. We love that kind of direction, and we often act on that and try and develop something that will be of use to you. So we are a resource at LiverWELL. That's what we're here for. So feel free to reach out to us with anything like that you have to suggest. Oh yes, this wonderful little graphic. This is my last slide, so we are definitely ahead of schedule. But again, these are some common myths or misunderstandings around hepatitis B transmission. Mosquitoes, I can't tell you how often, particularly in my prison sessions, that there is just like one person who gets really freaked out about mosquitoes passing bloodborne viruses around. Obviously, hepatitis B cannot be transferred by mosquitoes, which I'm very pleased about because I hate them enough. I don't need to worry about that then. Sharing food is not a way to pass hepatitis B. Holding hands is not a way to pass hepatitis B. Kissing is not a way to pass hepatitis B. Again, the people in prison are very good at asking all of the like nitty-gritty questions. And, you know, we did discuss that if you had a cut in your mouth and somebody else was bleeding in their mouth, there is a very slight possibility that you might be able to transfer hepatitis B, but it's pretty slim. The toilets, sharing a toilet is not a way to pass hepatitis B. And breastfeeding is something that there is often a bit of confusion about with hepatitis B. So there's no transmission from breast milk. That's not a way to pass hepatitis B. The only time to be careful is if somebody has cracked and bleeding nipples, to be careful at that point around passing through the blood into a cut in the baby's mouth. But yeah, it's mostly completely safe to be able to breastfeed your child if you have hepatitis. So that was the end of the hepatitis B presentation. Just allow for any final questions that anyone might have. Just checking through the chat. I can see it now. I've stopped sharing. I'm glad you like the bear story, Andre. It's actually not really encouraged anymore because clinical ideas have changed a little bit, but I just think it's the clearest way to explain to a person with hepatitis B why they need to go into continued care and monitoring around hepatitis B. And if anyone else has a story, I have heard a few people say we don't have bears in Australia, we need a different hibernating animal. I'm totally up for that as well. Well, yeah, somebody wants the prison exit info. Great. So yeah, that one does come up a lot for people who work with clients who are exiting the prison system. Within the prison system, hepatitis B vaccination, hepatitis A vaccination as well, actually, are offered for free. And also hepatitis C treatment is offered for free. And we have a wonderful system in the Victorian prisons now. There's 2.5 nurses that work for St Vincent's, and they move between all of the different prisons in Victoria. So that means if somebody is inside and they get transferred, they'll still be able to continue their treatment. There's good connectivity with that. And also the nurses take in a fibro scan so they can do your assessment for both hepatitis B and C. Well, actually, the testing is done by the clinics inside, but even if though they're not the ones doing those tests, they can actually prompt the clinics in the prisons to do those tests and follow up if those tests have occurred, because often clinics in prisons are pretty overrun with competing issues. So sometimes it's really good having an advocate there who can prompt them to follow up on things. But yeah, and so access to the hepatitis C treatment is wonderful in the prisons, and also to that vaccine. I actually saw some data this week that said that I think nearly 20% of all of our hepatitis C treatments are occurring in prisons in Victoria, which is quite amazing.